Every voice matters, every story counts. In the heart of South Sudan, a movement is stirring. Jamnel Care, in collaboration with the Ministry of Health, funded by Amplify Change, is hosting a groundbreaking sexual reproductive health and rights dialogue for 70 adolescent girls and women in Rejaf Payam. Over the course of the 3 days, these young women will come together to learn, share, and transform their lives.
المندير سنة كتير عن كيف أننا نساوين بقدر قبض بناتنا السكر كان بقى جا في عمر من عمر ربولوغا لهذه في عمر المهم بقى في 18 years من كيف بقدر behave بحاجات دي. جامنل كير كمان ودي لنا معلومات عن كيف أننا بقدر avoid domestic violence في بيوتنا واحد. violence دائما ما قال لي بعد برجال برانا نساين كمان يجيبوا violence.
إنه من قدر إنه بنادي people with disability كاريكم جزء من الدراسة طبعا في فكرة الناس يمكن بيفكر قال ناس اللي عندي disability ما عنده حق عشان شنو بيشارك كان في درس ولا في اجتماعات تانين يمكن people with disability يمكن بيشارك.
Today I have learned something very important about sexual reproductive health. They taught us a lot of things, like things about menstruation. If you start your menstruation, how will you manage it? How to protect our body. I would like to advise all girls, they should take care of their bodies because nowadays there are the sexual transmitted diseases.
They get to know about their bodies, they can have rights to their bodies, they cannot be abused anyhow. So like it's an education so that the girls and the boys in the community get to have knowledge more about their bodies, because sometimes some of them don't know who they are. They know their bodies, but you know they have rights to protect their bodies.
You know, as women and girls, this is not a curse. We were born naturally to menstruate. So some of the girls, you will notice that some girls face challenges during this period. We had an expert also on the ground who was telling them the right family planning methods to use, which ones go with their bodies. You first have to go to the hospital, you get checked, the doctor gets to tell you which kind of family planning method goes right with your body so that you choose.
We started with the introduction to the sexual reproductive health and rights, knowing their rights and the different components, and it was amazing. And when from one topic to the other, we also had a topic on menstruation. So we also trained on HIV and AIDS, and this is something that people really need to talk more about. So at least by the end of the training, at least some of the people came in. One of the participants were like, you know, by then we thought maybe beating was just a show of love to my wife and all that, but then you know that, you know, it's something giving, maybe hurting my wife or so, but then after the training they now realize this is hurting somebody, it's violence against the woman and so forth. So the one thing that I liked is how they come together, even with the people with disability. So bringing them together and knowing that, you know what, it is everyone's responsibility to take it up so that all the violation against women and girls comes to an end. Though they say that also, yeah, there are violations against men, so it also needs to come to an end.
I would also want to give thanks to appreciate the ministries for having responding to our request of collaboration, more especially Ministry of Gender and Ministry of Health, in which they were able to give for us a representative who always moves with us. We will continue to give awareness to all the 3 Payams that our project is mainly targeting.
Dirasa da ana dar kelimani Mr. Deres في community awareness. طبعا الناس تنا الكثير لسه ما بيفهم طرق عارفين وما بيلقوا أمراض من فوق. كمان السنوات بيعرفوا كيف حاجات الياس الجداد في الدراسة، كيف بيكون عندهم معلومات في حاجات عارفين HIV في كتير سنو حق مرة في سكس سنو أسنو بعرفوا الكويستو بطلتو.
The activity has been done in Rejaf Payam and we targeted 70 participants, but fortunately enough the numbers were many and we trained a total of 101 participants. Initially the intention of the project was to train women and girls on their paralegal training so that they can know their sexual reproductive health rights, and they can also know that sexual reproductive health rights are human rights.
Join us on this transformative journey as we cherish and uplift the stories of these young, resilient women fighting for their rights. Together, let us amplify voices and pave the way for a brighter future. This initiative is proudly implemented by Jamnel Care in collaboration with Ministry of Health and supported by Amplify Change.